Time for another Transformation Tuesday, and today we are putting the spotlight on the top plastic surgeries for men. So I know we talk a lot about plastic surgery for women here on the show, but I recently found out that there are more men that are heading in for plastic surgery, and Dr. Troy Pittman sat down with him and we had a great conversation. I want to share that with you guys right now. Take a look. Transformation Tuesday on Good Morning Washington is sponsored by Dominic Pittman, MD. Well, we are back with our good friend Dr. Troy Pittman right now, and we are talking about plastic surgery when it comes to men and plastic surgery. And I'm really excited to have this conversation with you because I feel like it's a conversation that I have with friends when we're out for happy hour, but we don't always know everything. So let's start with, what do you think, why do you think more men are seeking out plastic surgery?
Well, you know, it's so interesting because I don't think necessarily more men are seeking it out. More men are talking about it. So just like earlier, we were talking about how do you get men into this kind of frou-frou environment, traditionally very female-oriented environment. And I think men are talking about plastic surgery more. They're talking about it with their friends. We're talking about it more on social media, and they're becoming more comfortable with the conversation.
Let's talk about some of the top procedures that men are coming to you for.
When you think about the procedures that men are consuming or requesting, men really think about three main parts of their body: their face, their chest, and their belly. They think about a fourth body part, but it is morning TV.
Yes.
So when it comes to the face, injectables, wrinkle relaxers like Botox, fillers, we see a lot of men for that. As far as the chest goes, there are really kind of two things that I see a lot of men for. One is something called gynecomastia, or man boobs, where there's fullness, glandular tissue of the chest that feminizes the chest. So we can do liposuction to remove that fatty tissue. Sometimes we need to do a small surgical procedure to take some of that excess gland out, but it really masculinizes or flattens the chest. Conversely, guys who have smaller chests really do pec implants. We do a lot of pec implants. They're a little bit different than breast implants that we use for women. They're a silicone block, so they're not squishy. And that can give the chest a lot more fullness, upper pole shape, and enhance the chest a little bit more. So
I used to go to the gym hoping to get those pecs, which never happened, because I just didn't have that body type to create that.
Right.
But that's something that I could have done if I wanted.
Exactly.
Yeah.
I mean, we always want our patients to have maximized diet and exercise before we do anything. But some of these are just anatomic variations that men need a little bit of help with.
Yeah, I needed a little help with it. Let's talk about guys that are looking for six-pack abs.
Yeah, so the abdomen, another big request. That can be liposuction, where we're just toning the abdomen, getting rid of that excess fat of the front of the abdomen, those love handles that hang over everyone's jeans that they hate. We can liposuction that. We have a device called Vaser, which is an ultrasound liposuction, where that ultrasound energy goes in, it melts the fat, and then we're able to liposuction that fat out. Non-invasively, though, one of the biggest, I think, technological advances in non-surgical is something called TrueSculpt Flex. And this is a device that hooks onto the abs, and in 15 minutes, it stimulates or simulates doing about 30,000 sit-ups. Wow. And so men come in for a series of 4 or 6 treatments, and it stimulates the ab muscles to create more tone, more definition, and the results are pretty remarkable.
As we've seen from the pictures you just showed us, is there a procedure more men are seeking out that would maybe surprise me, our viewers at home? Yeah,
what's interesting is, particularly post-pandemic, I've seen more men for otoplasty or ear pinning. So one of the things that we see that really bother men are prominent ears, ears that kind of stick out to the side. It looks a little juvenile, and a lot of times it's bothersome to men. They want their ears set back a little bit. It gives them a more mature look. And we don't really know whether we're seeing more men for this because having a mask looped behind your ears for 2 years has actually caused the ear to become misshapen a little bit, or if it's that having the mask on, men are really looking at their ears a lot more than they did before. But that's something that we are doing a lot of, really a lot more since COVID, and it's pretty surprising.
What advice would you give a guy that's maybe watching right now, or their partner that is watching that knows that they've maybe struggled with something and want to take care of that and start that conversation about plastic surgery?
Well, they want to do their homework, right? So I think looking for plastic surgeons who really operate on a lot of men. It is a little bit more of a niche thing. You know, our practice is a little unusual in that 40 to 50% of our patients are male. And so you want to have experts, certainly board certified plastic surgeons, that are used to operating on men, are used to offering these procedures. Look at before and afters, see what the doctors can do, and be an informed consumer.
Dr. Troy Pittman, I always learn something new when I'm here. Thank you so much for your time.
Thank you.
And I think the conversation is that men pull off we're always confident and we don't want to change things about ourselves, but it's like, yeah, maybe there are some things we want to change, and if women can help start that conversation with their husbands and things like that, and then great doctors like that from Dr. Pittman and Dr. Michael Somnick.
Yeah, no, and I like that men just, we're becoming, more open about it, because, that's the biggest thing is, I think sometimes we have maybe a sense of shame that we're doing this, but no, and they've got, all of the best top-notch technology over there. I'm really excited because next week they're gonna talk to us about like a mommy makeover. So any moms out there that have maybe been thinking about, considering something, well,
I would love a man that's trying to better himself,
Yeah.
look like his best self.
Exactly.
Like, I think that's amazing.
Right.
I agree.